Good day, everyone. This is Team 7. Today, we are going to focus on career counseling presented by Mr. Rampadi and Mr. Mashalela. The aim of this exercise is to briefly synthesize you viewers with matters pertaining career counseling and ethical consideration. The scope points that we are going to focus on today is the ethical consideration applicable to psychological assessment for career counseling, mainly focusing on confidentiality, releasing test data, test security, integrity, and conveying test results. Secondly, career assessments, methods of interpreting results, and the question that will be posed and answered during the presentation is, are normative or ipsative interpretations of results more appropriate for career counseling? Lastly, we'll look at the methods of conveying results. The ethical consideration applicable to psychological assessment for career counseling. These are codes designed to manage and monitor the behavior of the professional psychologists and counselors. These ethical codes are in place to maintain professionalism in the field of psychology and avoiding the misuse of power on vulnerable clients by psychologists. The relationship between the assessment practitioner and the test taker, in many ways, represents a power relationship in which the practitioner holds most of the power, which leaves the client in a vulnerable position. Ethical testing and assessment practices requires that the assessment practitioner use tests appropriately, professionally, and in an ethical manner. The goal of ethical testing practices will be attained by practitioners who have the following: the necessary competencies covering the entire process of testing, a sound knowledge of psychometrics and testing, and an understanding of the broader social, cultural, political, and legal context in which testing is applicable, is applied, and the way in which these factors might affect test results, their interpretation, and the use which they are put. Van der Merwe mentioned some further examples of unethical practices in the implementation of psychological tests as provided below. Tests and test materials are used to advance the user's agenda, which is the psychologist or the counselor. This can be political or financial in nature. The use of outdated psychological tests, unqualified personnel using psychological tests. Some users apply the test in isolation and they do not integrate the results with other measures and show a disregard for responsible feedback and application. Now we're going to focus on confidentiality. Confidentiality, according to Schroeder and Coetzee, implies any information about any client must and will be treated as confidential, and this must be discussed at the start of every session. The psychologist must safeguard the information obtained in the course of practice, teaching, research, or other professional duties. Subject only to exceptional, the psychologist shall disclose confidential information to others only with the informed written consent of the client or the patient. Psychologists discuss with persons and organizations with whom they establish a scientific or professional relationship the relevant limitation on confidentiality, including any limitation on confidentiality that may apply to group, marital, and family therapy, or to organizational consulting, and the foreseeable uses of the information obtained. Now we're going to look at the releasing of test data. When can you release the data? The information of the client is not allowed to be disclosed, as mentioned before, to anyone except if the member gives consent. Instances where the information can be given to the third party without the consent of the clients. These are the instances when requested by the organization that referred the member to the career counseling, when mandated by the courts of law for valid reasons, to protect the patient or clients or others from harm, to obtain appropriate professional consultation, legally dependent clients, that is the guardian, reporting of abuse of children and vulnerable adults according to Child Care Act and Mental Health Act, discussion of clients' information among professional teams. One must ensure that the team is informed about the confidential nature of the information. When services are provided to more than one client during a joint session, for example, to a family or a couple, or parents and child, or a group, these are the instances where the information can be released without the consent of the client. Now we're going to focus on the test security, integrity, and conveying of test results. Test security. In order for test security to be ensured, the following must be taken into account. The use of coding or other techniques when entering information of the client to the database. One must not just put the ID numbers, for example, the names, the full date of birth. The codings must be used that only the psychologist or the counselor knows for security reasons. Personal identifiers must be deleted from the files if information is to be made accessible for research purposes. If personal identifiers cannot be removed, then before the information is made available to others, reasonable steps must be taken to obtain consent from the client. A plan in advance to protect confidentiality of records in the event of psychologist's sudden death, incapacitation, or being withdrawn from the position